John Moore, CEO of Yellow Brick Road, or kai whakahaere mātua te wahapū aho aho. Yellow Brick Road, prior to being called Yellow Brick Road, was called Supporting Families, and prior to that it was Schizophrenia Fellowship. It was very much started by people whose loved one got a diagnosis of schizophrenia and they didn't know what that meant. And once they learnt about what that meant, they wanted to help other people in the same situation as them. So we've been around since the 70s or 80s by different names, but we've evolved to what we are now. We support people with self-care to build resilience, to have the energy to look after their loved ones, and also to think about how they support their loved ones in a way that's really effective. We do education, so we help people understand mental illness, for lack of a better phrase, diagnoses, those sorts of things that can throw people a lot and can be very hard to make sense of. And the last bit we do is advocacy, helping whānau to be heard within the health system. Often services are heavily influenced by clinicians' opinions and clinical assessment, but whānau have their own view, and that's really important. So our starting point is usually a journey of self-care. It's really powerful when we come in to support someone whose life has revolved around someone else's well-being for a long period of time, and to help them focus on their own well-being is a really great place to start. You can't support someone effectively if you're struggling yourself. So we give people the permission to look after themselves, really, because we're working with people who are generally really selfless, and as I say, their well-being is massively tied up in the well-being of someone else.
And there's been
a big challenge we have is that when whānau come to us, they've often already been on a really long journey of trying to get help for their loved ones, and they probably haven't even considered getting help for themselves. Often things have got pretty bad before people have been able to get help, and often there's still a bit of a wait to get those services. The opportunity to help people earlier on and prevent the need for more complex and invasive and intense services would be great, but it's very much a work in progress.
It's my happy place.
Yellow Brick Road worked in a collaborative way with us, just helping me to be grounded, to think about what was going on and to think of alternative ways of being and talking with my daughter, so that we weren't focused on what was wrong, but what we were doing and what could be improved, what could change, and how the language and conversation occurred. The benefit for me was being able to learn different techniques. It was really easy to get locked into the, have you taken your medication? Why haven't you taken your medication? We were able to work through a lot of those issues with the hints and information and almost a talk sheet that Yellow Brick Road had given me. It was very practical and it was really helpful, and some of those skills have stayed with me. We still use them today, so that's really helpful.
So it's really natural for us to partner with organisations that are supporting people who are accessing mainstream mental health services. And it's a great way to collaborate, because often whānau and their loved one have different worldviews, have different opinions on things. And it's great for them to have their own support and for that support to be able to come together to get good outcomes for everyone involved.
So we have a youth respite and also
South Taranaki is a great place for collegial cooperation. All the organisations are really generous with sharing resources and work for the betterment of the people in the community. People pull together really well and cooperate really beautifully.
I'm from a family of 5, and over the years we've had a lot of involvement with Yellow Brick Road. Lots of great courses that have been really great at providing useful information and dealing with mental health. Also support meetings where you get to connect with other people in similar situations to you. And it's really great because everyone's really open and it's a confidential space where everyone feels safe. And that's been really helpful in kind of giving us all a shared approach and a common understanding of what we want to do and how we want to deal with things moving forward.
Whānau support is designed around a real non-clinical model, so we consider that whānau are first and foremost the experts when it comes to what they need and what their loved one needs. We're thinking about mental wellness in terms of holistic well-being, we like to think that our approach is really sustainable and builds health across all of the whānau and across their community as well. So it's a big part of what we want to do. We still have a medical model quite hardwired into our mental health system. It's about individuals who are unwell and providing treatment to them. And that's not really how wellbeing works. So we want to change a focus that's on unwell individuals to well communities, to people that have the skills to support each other to be well.